Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we're learning about organ donation, heart health, and fraud protection. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi, everyone. In the time that we will do this interview, this segment, about 7 to 10 minutes, another person will be added to the organ donation or organ transplant list in this country. And I think that's an important thing to bring out at the very beginning. My guest today, Dawn Benjamin with Donate Life Tennessee, and Rayshawn Morand, who is a double lung recipient, yes, looking so healthy and beautiful. Thank you. So glad to have both of you here. Thank you. So every 10 minutes, a new person is added to that list.
That's right. It really is a medical crisis in our country because transplants are so much needed today. Over 113,000 people right now on the national waiting list. Just to bring that home, about 3,000 of those people live right here in the state of Tennessee.
Astounding. Such big numbers. Tell us a little bit about the organization Donate Life Tennessee and the significance of organ donation, which you've already highlighted by just the sheer numbers of people waiting.
Yeah. Well, Donate Life Tennessee is our state's organization that manages the Tennessee Organ and Donor Tissue Registry. So our mission is to educate, encourage, and inspire people to take that step, document their decision, and sign up on the registry. One person can save or help as many as 50 people through organ and tissue donation.
I know through tissue donation, is it 50 at one time through tissue donation? And there was another interesting number.
8 lives are saved through the organ donation.
All right, now Rayshawn, I want to get to you pretty quickly here, since you are living proof of the beauty of organ donation. And tell us a little bit about your experience and your story. What led to you needing this transplant?
I received my transplant in August of 2015, and it was probably one of the 3 best days of my life. I'd gotten very, very sick with cystic fibrosis, and I was so weak that it was hard for me to stand while I brushed my teeth. I was almost so out of breath that I couldn't eat. I couldn't carry my purse anywhere, and I'd grown dependent on oxygen, so I had to be on oxygen at 24 hours a day. I was listed for the transplant on July 31st of 2015, and then 31 days later, I received my donor lungs.
That seems like a pretty quick turnaround. Obviously not for you when you're in that condition, but is that fairly fast?
I think so. The average time for kidneys, which is the most transplanted organ today, is about 3 years. So that's a really long waiting time.
I guess that's what I'm used to hearing about.
Yeah, that's because the need is so great. 80% of our list are just people waiting on kidneys, no other organ.
And why is that?
Well, what we have seen in the past 20 to 30 years is that we've seen an increase in the number of people needing a kidney transplant, basically because of diabetes and the prevalence of that disease.
Of diabetes. Okay, what is next after kidney transplants?
I would think liver is probably second.
All right. How has life changed for you? I mean, that is a big question, but can you carry on the way you did before you got so sick, now that you have new lungs?
Even better.
Better?
I really don't know that I ever knew what a real breath felt like before, because cystic fibrosis is something you're born with. Yeah. I thought, I didn't know I was sick until I was a junior in high school, so, just feeling that way was normal for me. But from the moment I woke up, before I even opened my eyes, I could tell such a tremendous difference.
I can only imagine.
It was incredible.
New life, new lease on life.
Yeah. The first thing I thought was, man, this donor must have been an athlete, because this is amazing.
Do you know anything about
I don't.
the donor? You don't.
I'm hoping maybe the donor's family is watching today, and they can hear my shout out to thank them for the decision.
No kidding. Who is eligible to be an organ donor? We know there are living donors, which is just fascinating to me. You
Right.
hear about that all the time, where someone will donate a kidney or part of the liver.
Right.
Who is eligible?
Who is eligible? Well, let's take living donation first. That would be something that a person would coordinate through a transplant center. Maybe they have a friend or family member who's in need of a transplant, and they could volunteer to be a donor, and then if they're a match, then that would take place. But they have to be healthy enough. They go through a very strict screening process because we don't want to endanger another person's life by doing that. Now, with deceased donation, anyone potentially could be a donor when they pass away. A lot of people mistakenly think that a medical condition like high blood pressure or diabetes would impact that. There are no medical rule-outs. You never know what you might be able to give. So we always encourage people to go ahead. If you want to be a donor, sign up on the registry. Let your family know this is what you want to do, and then at the time of your death, let the medical professionals decide if there's something that can be used to save or improve someone's life. Another very common myth is that people think they're too old. Age is not the factor. It's all about the health of the person and the health of each organ. And the best example that I give people is with the liver. The liver is the most resilient organ in the human body, and we've actually had cases in Tennessee where people were in their 90s and
You
they
are
still
kidding me.
able
Oh,
to
my.
pass on that gift of life to someone.
Incredible. Any other myths that you would like to clear up? Because I think some people, they still have a hard time with thinking about, you know,
couple
after
of-
death donating.
Sure. A couple of the top ones that we hear frequently is probably the number one is that I'm worried if I'm an organ donor that they won't work hard to save my
save me.
life. And that could not be further from the truth. The doctors, nurses, EMTs, those people are in the life-saving business, and they only call us when all life-saving measures have been exhausted. The second myth that's very common is a lot of people think that their religion would prohibit it. And that's not the case. All major religions support donation as an act of charity and kindness.
Is it enough to sign your driver's license or not?
We no longer sign a driver's license on
Okay.
the back. That
right.
is another misconception,
Okay.
and I'm glad you brought that up because people think that that's the way we do it. Today we have the registry, and that is the best way that someone can document their decision because it is considered a legal form of consent. So we treat it like an advance directive. You know how you decide to
Yes.
do a living will? You decide that you want to be a donor, you do this, so that we can carry out your wishes.
But you could even
so-
specify, I'm
Yes,
sorry to
you
interrupt.
can.
You could specify, I want to be a heart donor,
Correct.
liver.
Right. So the best way to do that is at the DMV when you go to get your license or renewal, or you can go online. You don't have to wait to renew your license. Today, if there's someone watching that wants to be a donor and they've not signed up, they can go online and take care of that.
Okay, Rashawn, in the few seconds we have left, your message to people watching to encourage them to be organ donors.
Please consider being an organ donor and talk to your family. Let them know your decision so that in the unlikely event that you were to pass, that they would know your wishes and not have to make that terrible decision in the time of grief.
And you are just a living example of the benefit of organ donation and the beauty of that. We're so glad you're here and
I'm
healthy.
very thankful. Thank you.
Thank you so much for coming in, Rashawn, and thank you, Dawn, for sharing the important information about organ donation. And we'll be back with a lot more right after this. Can't believe it's here already, but it is Heart Month. It's February already. Time just flies. And Dr. Stacey Davis, you've been so kind to come here every year to talk about heart disease on the program, sometimes a couple times a year. Good to have you back.
Thank you for inviting me again. It's always great to be here.
Yeah, we know there are a range of conditions that affect the heart that make up heart disease. There's so many different things that can go wrong. What are the most prevalent, the most common conditions that lead to heart disease or that cause heart disease?
The most common conditions that lead to heart disease are simple ones that we're all familiar with: high blood pressure, diabetes, high cholesterol. And we can't forget about the fact that we can inherit a tendency toward blocks in our arteries, so a family history of heart disease.
Let's talk about the American Heart Association and any kind of advances that they've made with heart health and how you support their efforts at St. Thomas Medical Partners.
Well, as you know, February is Heart Month, and this is the month that the American Heart Association, that St. Thomas Medical Partners, that everyone in Tennessee needs to put heart health at the forefront of your interest. And what we need to remember is that 1 in 2.5 women will die of heart disease. Yes, breast cancer is huge and it takes a lot of lives, but more women die of heart disease than breast cancer. And so we can do a lot to save lives by identifying heart disease early, identifying the risk factors that cause it, and then preventing them from developing to the point that heart disease happens.
Let's go over those things. And for some people, this may be a review, but it's important to review it again. Risk factors.
Risk factors for blocks in your artery or heart disease in general are high blood pressure, high cholesterol, diabetes, a sedentary lifestyle where you don't get exercise, being overweight, a family history of early heart disease, and if I didn't say this, high cholesterol.
Signs and symptoms that you may be in the middle of a heart attack. It's not always obvious, especially for women. It's not always the
Exactly.
crushing chest pain, we know that.
Right. So not everyone gets the crushing chest pain, the Hollywood heart attack. Some people have progressive shortness of breath with activity. For example, say you can normally walk through the grocery store without any shortness of breath, and now you can't get to the produce aisle at the back of the store without shortness of breath. That's a change in your exercise tolerance. Or if you live on an apartment in the second floor, and normally you can get up that stairway without shortness of breath or dizziness or lightheadedness, and now you can't make it halfway up. Swelling in your feet or ankles, or instead of chest pressure or pain, some people have left-sided arm heaviness or jaw pain.
If you do experience some of that pain, I know I had some shoulder pain recently and I started to panic remembering all the stories I've done on heart disease in the past, thinking, oh my God, are my palms sweaty? Are there other symptoms that will accompany that pain? Because it could be from exercise too, so how do you know?
Sure, exactly. Well, first of all, think about it for a moment and say, did I do some heavy lifting? Was I cleaning out my attic yesterday?
right.
And if the answer is yes, I did a lot of heavy lifting, well, if it doesn't go away within a matter of an hour or two or with rest, you ought to get attention. And there's nothing wrong if you're really not feeling well with going to the emergency department. We would rather have you show up and be evaluated. The job of the emergency department is to evaluate you and determine at what level of risk you are. People come in all the time and they say, oh, I'm so sorry to be here. I know you have people dying and I hate to be here. And we're like, no, that's what we're here for. We are here to make sure that nothing bad is going on, and if it is, to treat it right away.
If you are one of those people with high cholesterol, you had said before we started today that there is a new class of drugs for
Yes.
people who can't take the statins.
That is correct. So there are a lot of people who say, I've tried 3 different statins and none of them work for me. I can't take them. They cause my muscles to ache. I can't walk or exercise then like my doctor asked me. There's a new class. There are 2 example medicines out there, and they're called PCSK9 inhibitors. And the right way to take them is as an injection, because they're not a pill. And you take them as a self-administered injection once or twice a month. You don't have to take a pill every day. And then they have a tremendous impact on lowering your cholesterol. So don't give up if you're one of those people who's done everything they can to do to lower their cholesterol with diet, is exercising, and just can't take a statin. Talk to your doctor and say, I heard about these new medicines. Is that right for me?
Okay, all right, that's terrific, that new information. Now, if you just manage existing health conditions and maybe just tackle a few changes, right? Because it seems so overwhelming to just eliminate everything bad. And you know, you can't start running immediately. A lot of people can't, or working in a lot of
Absolutely
exercise.
right.
So baby steps?
Baby steps, absolutely. Change one thing at a time. Choose one thing you want to adjust. For example, I know a cardiologist who needed to lose weight, and he wasn't going to be able to start running right away, and he had a busy schedule. So what he started doing was walking every day, parked the car a little bit further. On weekends, walked. And it worked, and anyone can walk. And you might say to me, oh, but I'm so tired and walking is hard. Do you go grocery shopping? Spend a little extra time in the grocery store going through the aisles with that grocery cart in front of you, or do it at your favorite big box store. If you're a guy and you like to go shopping at big hardware stores,
Yes. I like that. That's great.
then go up and down the aisle with that cart.
Okay.
And those places are awfully large.
They
You'll
are.
find lots of tools to buy, and you'll get your exercise.
Yes, that'll raise the endorphins too, finding that perfect tool, right?
That's right.
All right. Thank you so much. I'm very excited about the new inhibitors, that new class of drugs too for people who can't take statins. Thank you so much, Dr. Davis.
You're welcome. My pleasure.
Appreciate you coming in. Happy Heart Month.
Happy Heart
All
Month
right.
to everyone.
Yes. And we'll be back with more after this. This next segment, we're talking about fraud, and I'm really thrilled to have Sergeant Michael Warren here from Metro Police, from the Nashville Metro Police Department, to talk about maybe the most common threats against people when it comes to fraud in our bustling, growing city. Tell me about what you're seeing the most of in terms of fraud.
Well, identity theft happens every 30 seconds.
Every 30
Every
seconds.
30 seconds, 2 a minute is what they say is the average rate.
I had no idea.
Yeah, and that can include your credit card. It can include your identity, social security number. It can include when you're trying to rent real estate and you fill out contracts and things like that you mail. All those things are avenues for the bad guys to take over your identity. So twice a minute.
Twice a minute.
Mm-hmm.
How do we protect ourselves? I know one thing I've heard numerous news reports concerning people using their credit cards at gas pumps.
Yeah.
And then people come
So-
along and put a device in to capture that
Absolutely.
information.
The threat at a gas pump obviously is a skimmer.
Skimmer.
And so what people don't understand a lot of times there's a difference between a gas pump skimmer and an ATM skimmer. And so a lot of people think that they work off the same methods, and they don't. An ATM skimmer is a device that's attached to the outside of the ATM, whereas a gas pump skimmer is actually attached inside the gas pump. So you and I as a customer have no idea.
would never know.
No idea. And it's open, they actually open the gas pump door and they attach the device inside to the motherboard. They actually interrupt the circuitry and run it that way. So totally, and that's the reason we encourage people all the time to look for the seals on the gas pump. Have you ever noticed a seal on the gas pump?
No.
It's a sticker. So if you look opposite the hinge on the gas pump door, you'll normally see a sticker that the gas station is placed there. And if it's been disturbed, then it's saying, hey, this gas pump's been opened. And that's the number one indicator. If you use a gas pump, you should always be looking for a sticker.
All right, I also thought use the pump closest to the attendant.
Absolutely.
But you don't know if they're on their phone or if they're paying
Sure.
attention either. But
I highly recommend places that are 24 hours if you're going to get gas, because it gives a less window of opportunity for the bad guys to install a skimmer. It's not foolproof, but it lessens the likelihood that a skimmer's been attached to a gas pump there.
what about credit card fraud? You said that is the most common fraud that
Yeah.
you investigate here.
Absolutely. We get over normally about 80 reports a week of credit card
80.
fraud. Yeah. And so many people think that, well, as long as I'm safe, and that's not the case. You know, a server can take a picture of your credit card. Of course, it can be skimmed at a gas pump or an ATM. You could enter it into the wrong website. You think you're on a legitimate website, you're actually on a phishing website. There's just so many different ways. We had a business in Nashville that actually had their machine taken over one night, and it shut down because it ran over 30,000 manual credit card entries. And what they did is they had actually compromised the system, was just running random numbers.
Was this a restaurant or
It
a
was
bar
actually
or
just a small business here
small
in Nashville.
business?
Mhm.
So what do people do to protect themselves? I mean, obviously look at your statements regularly,
Yes,
check.
absolutely. Well, this day and age, if you have a smartphone and your bank offers online banking, I bank with Bank of America, and they offer alerts, and so does my credit card. I have my threshold set up at 1 cent. I want to know anytime a transaction goes through. And that way, if I do see something that's illegitimate, I can immediately make the phone call and get it shut down.
Address it immediately.
Absolutely. Another thing I highly recommend is that people take a picture of the back of their credit card, just in case the card becomes lost or
Oh,
stolen.
of course.
Those minutes are critical. So if you're out at a restaurant or whatever and you realize when you got home that your card's missing, now you got to go trying to find a bank statement or get online and try to find what their customer service line is. That's on the back of your card. And that's the most direct line, because guess what? They want you to call too, because their money's on the line.
Sure.
And a lot of people, if you lose the card, you've lost your contact information. So I encourage people to take a picture of that, have that somewhere else other than just the back of the card, because those minutes are precious in preventing damages.
Well, great advice. Any scams related to health care?
So the only thing we've really seen in the healthcare is where people are impersonated and they get a bill after the fact that says that they attended an ER, and they're like, I've not even been to an ER. But we haven't seen anything like other than that. It's just someone goes in and uses their information. And sometimes that can just be poor vetting protocol at the hospital, or it could be that the person has a lot of your information, was able to go in there and act like they're you.
What about embezzlement cases? Do
Sure.
you see a lot of those?
Absolutely. Every day, embezzlement could be an employee who steals $10, and it could be a 30-year employee who's the bookkeeper who stole $1 million. And we've seen them all, honestly. And we probably get 5 or 6 of those a week. Some of those are misdemeanors that we can, refer them straight to the district attorney, and some of them require months and months of investigation.
What types of cases lead to criminal charges versus a civil matter?
Okay. To make it as simple as possible is if we can articulate theft. And so what it requires to meet the statute of theft is that someone intentionally deprived you of ownership. And so we see a lot where someone pays to have repairs done on their home, and they come out and they do half of the job, and they don't show up again. And they call our office and they want us to prosecute them. Unfortunately, that's going to be a breach of contract, because that's just someone who didn't fulfill the contract. There's no way we can articulate that their intent was to steal your money. Now, did they run off with your money? Absolutely. But that's a civil matter. Now, they agreed to put a roof on your house and never show up. Now, that's something we can articulate, that their intent was to never put a roof on your home. They were just there to take your money. And those are incidents that we can actually pursue criminally.
In our last few seconds, where can I get more information? Where can folks watching get more information
Absolutely.
about protecting themselves?
Sure. So FTC.gov is a really good resource.
FTC.gov, okay.
And identitytheft.gov is a really good resource. And of course, we also have police.nashville.gov, and there is a fraud link on there. And of course, call our office if you have any questions. We're at 615-862-7594.
All right, Sergeant Warren, thank you so very
Absolutely.
much. Really appreciate good advice and
Thank
great
you.
tips for us.
Thanks.
And thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.